हेलो फ्रेंड्स, आप सभी का हमारे यूट्यूब चैनल पर स्वागत है। आज का हमारा टॉपिक है हेड इंजरी और ट्रॉमेटिक ब्रेन इंजरी का नर्सिंग केयर प्लान। इन दिस वीडियो वी लर्न अबाउट द नर्सिंग केयर प्लान ऑन हेड इंजरी और ट्रॉमेटिक ब्रेन इंजरी। इन दिस process we make here the nursing care plan by the using following nursing process step, that is nursing assessment, nursing diagnosis, expected outcomes, goals, intervention, rational and evaluations। मीन्स हम यहाँ पर नर्सिंग प्रोसेस के जो भी स्टेप्स हैं उनका यूज कर एक नर्सिंग केयर प्लान तैयार करेंगे। तो आइए देखते हैं हम किस तरह से हेड इंजरी का नर्सिंग केयर प्लान यहाँ बताते हैं। बिफोर गोइंग टू नर्सिंग केयर प्लान, फर्स्ट वी लर्न अबाउट द हेड इंजरी और ट्रॉमेटिक ब्रेन इंजरी। यहाँ पर हम इनका एक शॉर्ट इंट्रोडक्शन देखते हैं। हेड इंजरी आर डैमेज टू द स्काल्प, स्कल, ब्रेन caused by the trauma. When it affect the brain, they are called the traumatic brain injury या TBI। मीन्स हेड इंजरी मीन्स जब हमारे स्काल्प, स्कल या ब्रेन पर किसी भी प्रकार का चोट लगे, ट्रॉमा हो, उसको हेड इंजरी कहते हैं। और ये यदि ये चोट इंजरी ब्रेन को भी अफेक्ट करे तो ये ट्रॉमेटिक ब्रेन इंजरी कहलाता है। नेक्स्ट, हेड इंजरी इज द डिसरप्शन ऑफ द नॉर्मल ब्रेन फंक्शन ड्यू टू trauma related injury resulting in compromised neurological function, resulting in focal and diffuse symptoms। Means in head injury there is disruption of the normal brain functions due to injury in the brain, and this results in compromised neurological status. Next, motor vehicle accident are the most common cause of the head injury or most common etiology for this injury। Next, traumatic brain injury may vary in degree of damage to brain tissues as a result of injury. Primary impact on to the brain may occur as skull fracture, concussion, and cerebral vessels damage. Secondary problem are hematoma, rupture of the blood vessel, ischemia to brain tissue, infection and increased intracranial pressure। ये था हेड इंजरी का एक शॉर्ट इंट्रोडक्शन। नेक्स्ट देखते हैं डिफाइनिंग करेक्टरिस्टिक्स ऑफ हेड इंजरी। मीन्स हेड इंजरी का साइन एंड सिम्टम्स। Here defining characteristics of head injury means sign and symptoms of head injury. Here first we see here the minor head injury symptoms. Here headache, lightheadedness, spinning sensation, mild confusion, nausea, ringing in the ear means tinnitus. Next, symptoms of the severe head injury include loss of consciousness, seizures, nausea and vomiting. These are the some specific features related to the head injury. And here also the balance or coordination problem, serious disorientation, inability to focus the eye, abnormal eye movement, loss of muscle tone, persistent or worsening headache, memory loss, changes in mood, leaking of clear fluid from the ear or nose. These are the symptom of the major head injury types। नेक्स्ट जो हमारा टॉपिक है एड नर्सिंग केयर प्लान, इसके अंदर हम डिफरेंट नर्सिंग असेसमेंट, डायग्नोसिस, एक्सपेक्टेड आउटकम्स, गोल, इंटरवेंशन, रेशनल एंड एवेल्यूशन के थ्रू ये केयर प्लान आप पूरा करेंगे। तो हमारा केयर प्लान का फर्स्ट डायग्नोसिस देखते हैं। Here the first diagnosis is decrease intracranial adaptive capacity related to injury with cerebral edema, intracranial hemorrhage and increased cerebral blood flow as evidenced by the increase in intracranial pressure more than 10 mm of Hg। This is our nursing diagnosis. First number here, assessment of this diagnosis. First assessment, assess the patient's GCS level, pupil size, reactive to light or not. Next, second assessment here, report immediately after finding deterioration in the neurological status. Next, number third, assessment assess for rhinorrhea, autorrhea, battle signs, ecchymosis over the mastoid process, and reconcile means periorbital ecchymosis. Next, number fourth, assess for protective reflex like swallowing, gagging, and coughing. And number fifth assessment here, monitor vital sign. Number six, assessment monitor intracranial pressure through corneal catheter device. Inform immediately if it is more than 15 mm per Yg. Next assessment here, monitor oxygen saturation regularly if required. Assess arterial blood gases or as ordered. Means these are the nursing assessment of this diagnosis. On the basis of this assessment, we plan here the nursing diagnosis for such patient as head injury. This here the nursing diagnosis for head injury. Number first here, decrease intracranial adaptive capacity related to injury with cerebral edema, intracranial hemorrhage, and increased cerebral blood flow, as evidenced by the increase in intracranial pressure more than 10 mm per Hg. नेक्स्ट स्टेप देखते हैं आउटकम और गोल्स फॉर दिस diagnosis. Here outcomes of this patient maintain normal cerebral tissue perfusion and ICP less than 10 mm of Hg. This is our goal for this diagnosis, and here are various intervention and rationale for this to achieve the goal. Here first intervention, elevate bed up elevate bed up to 30 degree and keep head in neutral alignment. Here rationale for this, it promote venous outflow and decrease ICP. Neutral head alignment facilitate venous flow. Next, number second, the second intervention, limit nursing and medical procedure. Here rationale for this, any stimulation can contribute to the increased intracranial pressure. Next, number third, little loose tapes should be there to secure the endotracheal tube. A rationale for this, tight tape may compress the jugular venous flow. Next, number fourth here, intervention, reorient the patient about the environment, provide psychological support. A rationale for this, it decrease the anxiety and maintain intracranial pressure at the normal level. Next, number fourth intervention here, avoid Valsalva maneuver. It increase intrathoracic pressure and increased intracranial pressure. Number fifth intervention, administer mannitol as ordered. Here rationale for this, mannitol must be used continuously because it can also induce cerebral ischemia. Next, number six intervention, hyperventilate before suctioning through the trachea. This rationale for this method avoid hypoxemia, hypotension, and hypercapnia, which results in and increase ICP. These are the interventions for this diagnosis. After providing these interventions, we see the patient for the achieving goal or not. Here, this is done by the evaluation process. Here, evaluation for this diagnosis here, maintain optimal cerebral tissue perfusion and intracranial pressure less than 10 mm of Hg. Here our goal is achieved. This is the first nursing diagnosis. You can take your notes here with this video pictures. Next diagnosis number second here, risk for electrolyte imbalance, excess fluid volume related to compromised regulatory mechanism with an increase in antidiuretic hormone. Here nursing assessment for this, assess the patient's electrolyte value. Next second, check patient's weight. These are the nursing assessment for this. On the basis of these assessment, we write here the nursing diagnosis for this patient. Here diagnosis here, risk for electrolyte imbalance, excess fluid volume related to compromised regulatory mechanism with an increase in antidiuretic hormone. Your expected goal for this to maintain electrolyte balance. Next intervention for this year, interventions and the rational year. Number first intervention, monitor sodium level, weight, and notify healthcare provider in case of significant findings. Rational for this, in presence of a syndrome of inappropriate antidiuretic hormone secretions and SIADS, the patient has inappropriate urinary concentration cause excessive water retention. If the sodium level reaches below 118 millicranal per liter, there may be seizure activity. Next intervention, check patient fingerprints. Rational for this, it indicate cellular edema. Next, number third, fluid intake may be restricted to 500 to 1000 ml per 24 hours. Here, rational for this, fluid restrictions help to achieve homeostasis. Next, pre-op sodium may be advised. It normalize sodium level. Next, elevate the head of the bed to 10 to 20 degree in case of hypovolemia is present. Here, rational for this, it promote venous return and reduce antidiuretic hormone release. Next, number 6. Here, the regular specimen should be sent for evaluating electrolyte level, especially sodium. Here, rational for this, to check the improvement in sodium level due to the treatment. Here, these are in the interventions for this diagnosis. And next, take the and evaluation for this diagnosis. Here, maintained electrolyte balance. Here, our goal is achieved by these interventions. Next, take the diagnosis number third. Here, this is in diagnosis number third. For this, first we see here the assessment. Number first, observe the patient to any seizure activity. Next, record and report time of onset, duration of seizure, and post seizure state. Next, assessment, monitor any sign of airway obstruction. After assessment, we write here the nursing diagnosis for this patient. Here, diagnosis is risk of seizure related to cortical laceration, intracranial bleeding, hyponatremia, hypoxia, or penetrating injury to the brain. These are the uh, risk factor for this seizure activity. Here, goal for this diagnosis. Here, goal is the patient does not sustain injury due to seizure activity. The patient does not experience any seizure activity. For achieving these goals, we provide different interventions for the patient and rational for these interventions. The first intervention for this, take seizure precautions like raising beds and rails, padding up beds. Rational for this, to prevent injury from seizure activity, the safety of the patient is very necessary. Number second intervention here, administer anticonvulsant as per doctor's advice. Rational for this, it is necessary to follow the right of the administration of the medications. Next, number third intervention, during a seizure, do not try to put anything in the patient's mouth and maintain airway. Rational for this, inserting objects may cause aspiration or more harm to the patient, like broken teeth or soft tissue injury. Next, number fourth intervention here, after the seizure, turn the patient to one side, suction and administer oxygen if needed. Here, rational for this, to clear the airway and prevent hypoxia. Here the different interventions. After providing these interventions, We see the patient for evaluation here. Here our evaluation is the risk for seizure activity reduced. Here our goal is achieved. Next, the nursing care plan number 4, head injury. Here nursing diagnosis number 4. Here nursing assessment. Regular monitor patient's electrolyte and protein and glucose. This is assessment number first. Next, second assessment here. Assess for the muscle mass, skin color and target. Next assessment number third. Here assess the rate and quality of the bone dealing and extra calorie are required to heal bone. Next number fourth assessment here. Regular check of the weight. These here on the basis of this assessment we write the nursing diagnosis here. Diagnosis is risk for imbalance nutrition less than body requirement related to facial trauma, restrictions of intake, impaired level of consciousness. For achieving our goal here, we write the expected outcomes or goal for this diagnosis to treat the patient here. Goal is to maintain normal nutrition pattern of the patient here. Interventions for this achieving the goal here. First intervention, administrative feeding here rational for this and head injury patient need around 2000 kilocalorie per day. Multiple injuries require more calorie and nutritional support can be provided through the IV route by placing a central venous catheter. Sorry. Next, to maintain the head of the bed at 30-degree here rational for this. It prevents the risk for aspiration through tube feedings. Next, avoid inserting the feeding tube through the nose in case of basilar fracture. Here for this, in basilar fracture, insertion of a feeding tube could penetrate the brain tissue through the fracture. These are the various interventions for this diagnosis. After providing these interventions, we see the patient for the our goal is achieved or not. Here evaluation for this diagnosis. Normal nutrition pattern maintained. Here goal is achieved. Next देखते हैं nursing diagnosis number 5th. Here diagnosis number 5th for assessment for this diagnosis. Assess the patient's knowledge about the head injury and its treatment plan. Here diagnosis deficient knowledge related to lack of experience with head injury. Here expected outcomes and goal. Patient will demonstrate about the disease process and intervention for this year. Intervention and the rational number. Intervention number first, assess the patient's cognitive ability and receptiveness to learning information. Rational for this. Brain injury might affect short-term memory and cause behavior and mood change. And next number second, teach the patient and their family member about the injury and treatment plan. Here rational for this. Most patient and families have no prior experience with head injury. Next number third intervention, update patients and family member regularly about the changes in health status. Here rational for this. They provide unique information about the client's baseline before the head injury. Next number fourth intervention, prepare the patient and family to possible need for physical occupational speech therapy and ongoing home support. Rational for this. Rehabilitation can be a long process that goes beyond in the hospital. These are the various interventions for achieving these interventions. We see the patient for a knowledge level here evaluation. In evaluation, patient having adequate knowledge about the head injury and improve the level of knowledge of the patient. And this is the nursing diagnosis number 5th. फ्रेंड्स, ये हमारा नर्सिंग केयर प्लान कंप्लीट हुआ हेड इंजरी का। इसके साथ साथ आपको यहाँ से नोट्स ले सकते हो थ्रू दिस वीडियो पिक्चर। This is first nursing diagnosis content here. Here continue first nursing diagnosis. Here continue first nursing diagnosis, and this is completion of first diagnosis. Next second diagnosis here. Uh, you can take notes your by this picture. This is second diagnosis here. Complete. Next nursing diagnosis number third. Here third diagnosis complete. Next nursing diagnosis number fourth. Here fourth diagnosis complete. Next देखते हैं number fifth diagnosis. This is a number fifth diagnosis. You can take notes or material for this diagnosis. Here fifth diagnosis complete. तो ये थे हमारा हेड इंजरी के डायग्नोसिस। तो फ्रेंड्स, ये था आज का हमारा वीडियो नर्सिंग केयर प्लान ऑन हेड इंजरी और ट्रॉमेटिक ब्रेन इंजरी। तो आपको वीडियो कैसा लगा, इसके लिए अपनी लाइक्स कमेंट ज़रूर भेजिएगा एंड शेयर दिस वीडियो विद अवर फ्रेंड्स एंड सब्सक्राइब माय यूट्यूब चैनल। जिन्होंने अभी तक सब्सक्राइब नहीं किया है, प्लीज़ सब्सक्राइब दिस यूट्यूब चैनल Anand's nursing pile preparation for nursing competition examination here and press bell icon also. Thank you.